Hello, I am Dr. Helen Voronina. Have you ever experienced a toothache and wondered how urgently you need to see a dentist? Well, today I am going to share with you the most common causes of a toothache and what you should do about it. So let's get started. Number 1. Let's say you have a dark stain on your tooth. This could be harmless, but it could also be an indicator of decay. There is no need to panic, but it really should be assessed by a dentist within a few weeks or so, just to be sure. Number 2. Perhaps many or all of your teeth are tender at the same time, especially in the morning, sometimes coupled with facial tenderness and headaches. But you're not in excruciating pain. The cause is most likely grinding, a condition referred to as nocturnal bruxism. Not a dental emergency, but the chances are you've been grinding your teeth for quite some time. It can wait for a few weeks or even a month. But putting it off for too long isn't advisable because you can end up cracking or fracturing your teeth. Number 3. One of the most common symptoms people experience is a sensitive tooth. This could be a sign of many conditions. It could be mild tooth wear, decay, a broken tooth, a degraded filling, or the beginning of a more serious problem. Not something you want to ignore, so you should have it looked at sooner rather than later. Number 4. A broken tooth. Let's say it's your front tooth. This is an aesthetic issue and it can be repaired, so it's not the end of the world. As far as a back tooth, this is even less urgent. And if it's sensitive to temperature, it's not necessarily a bad sign. It means that the tooth is still alive. It can wait a few days, but in both cases, for your own comfort, you should really see your dentist within a week or so. Number 5. A decayed tooth, which often presents as a broken tooth. This could be a minor or a major concern, depending on the extent of decay. Your dentist really needs to have a look at your tooth within a few days to a week. Number 6. You're experiencing sharp, nervy pain when biting hard foods such as nuts, seeds, or toast. This is almost certainly an indication that you've cracked a tooth. Once again, this can be minor or major depending on the extent of the crack. Not necessarily an emergency, but it's best to avoid eating on it and get yourself to a dentist within a few days to a week. Number 7. If you're experiencing a throbbing or pulsating sensation and the tooth feels bruised when biting, especially if combined with tenderness and swelling in the mouth, this could be an indication of an infection and needs to be examined by a dentist within a day or two, as it can escalate quickly. Number 8. Severe pain that keeps you up at night and is not relieved by Panadol. This often means you have a dying nerve. This level of pain will not leave you wondering what to do. You'll be desperate to get yourself to a dentist. Number 9. Your face is swollen. This is referred to as cellulitis. Potentially, a tooth abscess has spread to the surrounding tissues of your face. Now, this is an emergency and potentially life-threatening. You need to contact a dentist or the dental hospital urgently. I can't stress enough, this can escalate quickly and urgent action is required. Number 10. You've had some type of trauma to the face which has resulted in broken or lost teeth. I really don't need to tell you this, but get yourself to a dentist fast. If the whole tooth has come out, suck it clean and keep it under your cheek while you're on your way to the dentist, as the tooth could potentially be saved. There you go, 10 most common causes of a toothache. I'll end on the tooth fact. When you think your teeth are reacting to hot or cold, they're actually feeling pain. So if you're experiencing a toothache, it's your tooth's way of telling you that things aren't quite right and you need to get it checked out. Or you could do what Tom Hanks did in Castaway and take it out yourself.